that, we move to AB 1230. AB 1230 will essentially prohibit declawing for any other purpose than therapeutic. The executive committee and I have discussed a number of concerns raised with the author's office. They have been very open to listening to our concerns, and one of the concerns that we raised that they did address through an amendment was a requirement that all veterinarians who perform declaw would have to then report that to the board, and we would essentially be investigating every report and determining whether or not it met the statute, which I felt was very cumbersome, and it would be a huge unnecessary burden on the board and board staff to implement. And so they made an amendment that changed it to the requirement that they would just have to notate in the record the therapeutic purpose, and that achieved their same intent of it. So with that, though, I do want to turn it over to the executive committee to express their thoughts on this bill.
Do you want me to go first?
Sure.
So I hope that we can all agree that cats shouldn't go outside. My own personal cats have never stepped 1 foot outside. And my feeling is that if clients want to declaw their cats in order to keep them inside where it's safe, then that's their personal choice, and they should have that choice if they elect that. We know that cats go outside, that they are in danger, they get hit by cars, they get attacked by other animals, they get exposed to all sorts of infectious disease, and besides that they do a lot of devastation to the bird life and other little animals, little creatures that are out there. I also believe that the legislature shouldn't be legislating the practice of veterinary medicine, that they should not be dictating what procedures are allowed and what procedures are not. So I would urge people to oppose 1230.
In addition, I did reach out to some of my friends and colleagues in the UK that are either involved in veterinary teaching hospitals or practice, and because if you're not aware, it has been banned in the UK for quite a few years now. I think it was 2006. And they shared several anecdotal opinions with me. One of them was that it was already on its way out, and very few practitioners were doing it on a routine basis. But without exception, they all told me that that cats under the age of 6 have a 25% chance of getting hit by a car in the UK. That's the statistics. 25% of them are killed on the road. And that cats don't tend to, again, these are opinions, but they don't tend to be indoor animals in their practices. So again, I don't have a large number of responses. I just reached out to 3 or 4 of my colleagues that I know there. And I think my biggest concern at this point is legislating the veterinarian's practice, so the ability to practice medicine. I remember in practice, Jessica cautioned me on this story, but I'm going to tell it. I had an older client that whose physician had recommended that she get rid of her cat because of her immunocompromised state, and the cat was a pretty vicious cat, and so she tried soft paws, and she didn't have the dexterity to do that. So we ended up starting to anesthetize the cat on a weekly basis so that we could trim its nails, because we were afraid of the cat. But she loved this cat, and it was her only, source of comfort. And so I look back on that one particular case in my practice history. We ended up declining the cat. It wasn't our first choice, but it was our only choice at that point. So I guess I worry about the people that might fall through the cracks. I know there are no medical organizations that have stepped up to oppose this bill. In fact, I know that the sponsor has some letters of support from different medical practitioners, but I think we could probably find people to write letters on the other side of that coin, because I think that it's really hard to legislate every circumstance. So those are my thoughts. I open it up to the rest of the board.
I think it's mutilation, plain and simple. All the animals I have come in contact with as a shelter worker, as a private citizen, that have been declawed have serious bite. They bite all the time. We had animals relinquished to our shelter after decline. It was so hard to get them adopted because they just bit all the time. They were just behavioral, messes. And they ultimately were euthanized in our shelter. So I would respectfully disagree with you both.
I can tell you that I have not noticed that at all. Not that declawing is a common practice in my practice at home. For 8 doctors, I looked last year. For 8 doctor practice that I have, we did a total of 21 cats last year. So it's less than 3 cats per doctor per year. So it's not a common procedure, but if some people come to that decision and it needs to be done, then we will do it. We give them options, and we talk to them about all the disadvantages. But I can say that I have never noticed a connection between aggressive cats, that declawing causes aggressive cats. Those cats may have been declawed because they were aggressive to start with. Maybe they declawed them because it's hard to handle them, so they declawed them in an attempt to keep them. I don't know. But the most common thing that I saw causing aggressive cats was bottle feeding them. Those all grow up to be nasty cats. So anyway, that's my personal opinion.
Jennifer.
I'd like to start by saying how much I hate declawing. I would never do it, but my concern with making it illegal is that people are going to do it anyway. In the bill, it says that it's going to be, that it would be restricted to a licensed veterinarian. It's a surgical procedure. It should already be restricted to a licensed veterinarian. And I say we regulate it and make sure that we're using appropriate nerve blocking and pain medication, but making it completely illegal is putting the cats at risk that people are going to be trying to do this in their garage, and that's my concern.
Likewise, am not a fan of declawing, and I don't with all of my 5 cats. My biggest concern here is if you outlaw it, I would rather see a cat declawed in a happy home than have claws and be let loose or turned into a shelter. So, I just worry that if we're restricting it, that we're going to lose, cats will lose some homes in the process and be turned over to shelters or abandoned altogether, and I don't think that's the right way. So that's why I'm concerned about outlawing it.
I also don't love the idea of declawing cats. My own cat, I adopted her declawed at 4 years old, and she's very loving. She doesn't bite, so I'm lucky, I guess. But she's 21 now. She did get out once when I lived during my internship when I was on a cattle ranch, and some dogs chased her, and she couldn't get up the tree. I was able to get her in time, but that obviously is something that is not a great thing. My other cat has claws and rips up my furniture. I'm a lot more tolerant, though, than some people, and because of that, I think that it would... There's a lot of cats that don't have homes right now and need homes, and I know some people would never adopt a cat if they couldn't have them declawed, and I think just like Jennifer said, this would lead to people doing it sort of under the table, and we wouldn't have any oversight on it, and I think it would hurt cats in the end more than it would help them.
Dr. Nunez?
You're going to make me say something.
Yes.
I'm opposed to declawing, but I agree that it's a procedure that is falling off by the wayside. it's difficult to make comparisons between us and what they do in Europe because our pet owning behavior of having indoor cats is much different, like you said. And I'm even more so, I'm not in favor of regulating what surgical procedures can and cannot be done. The regulation of veterinary medicine, even though we're a regulatory body, we rely on the veterinarian and the patient to make the decision of what's medically best for their pet, for their patient.
Any more other comments by the board? Can I entertain a motion, or shall we ask the public? Public comments? Yes.
Okay, I'm not going to comment on decline one way or the other, but my comments relate to the issue of a non-therapeutic decline. So who's going to make that determination? I know that there will be a lot of differences of opinion as to whether the decline was therapeutic. That's going to be an issue. I also think that it's very harsh where in section C of 4832 it says that the board shall make a determination as to whether or not to revoke the license of the veterinarian. I mean, the board always has the ability to impose discipline, so I would suggest that that's something that you don't want to have automatically in this section. Thank you.
Any other public comment? Do you want to read that, or? Okay. Does anyone want to make a motion on the board to address this? You're all so eager.
Okay, I make a motion to oppose.
Second.
Any further comment from the board? Any further comment from the public? Call for the roll.
Ms. Bowler,
Yes.
Dr. Bradbury,
Yes.
Ms. Laredo,
Yes.
Dr. Nunez,
Yes.
Dr. Waterhouse,
Yes.
Ms. Yanis,
No.
Dr. Nolan.
Yes.
Motion carries. Okay. AB 1553 makes non-substantive changes, technical changes, replace pound with animal shelter and replacing references to destroying an animal with references to humanely euthanize the animal.
Motion to oppose. I'm just kidding.
Yeah, I was going to just keep people awake.
Motion to support.
Second.
Is this bill likely to change any? I have a question.
Well, that's the other.
I mean, it's only April, so.
That's what I mean.
Okay, I think I'm entertaining a motion here to support, and a second by Cheryl. A discussion on the board. Discussion from the public. Call for the roll.
Ms. Bowler,
Yes.
Dr. Bradbury,
Yes.
Ms. Laredo,
Yes.
Dr. Nunez,
Yes.
Dr. Waterhouse,
Yes.
Ms. Yanis,
Yes.
Dr. Noland.
Yes.
Motion carries. Yeah.
Yes.
All right. So SB 53 Open Meetings Act. So this one would essentially require any public meeting with 2 members and any committee with 2 members make it a requirement and subject to the Open Meetings Act. And this is 2 members of the committee with only one being a board member, which is concerning considering the amount of committee meetings that we have. Committees don't make final decisions. They primarily do a lot of research and then make recommendations to the full board. Subjecting every 2-member committee to open meetings, I think, would be severely inefficient and costly to do. I don't think this is necessary. I do want to speak to the arguments in opposition, Board of Accountancy, to at this point has taken an opposed position, and I think they described it well. So I was going to read just their argument in opposition. They said this bill would prevent the CBA and its committees from asking two members to review a document, draft a letter, provide expert analysis, or advise CBA staff on other matters without giving public notice. SB 53 may prevent the CBA from conducting certain outreach and communications activities that would include more than one member present, as that may constitute a meeting and therefore be subject to the Open Meeting Act. This bill would also appear to prohibit two board members meeting together with legislatures in support of any important consumer protection issues relating to the practice of public accountancy, as it would be impractical, if not impossible, to publicly notice such visits.
I'm really confused. I'm reading 3. Why are you saying 2? It says consists of 3 or more individuals.
Except a board, commission.
Except a board, commission, or committee, or similar multi-member body, which is us in our committees.
So every other member of government except for boards, commissions, and committees can have
3. Well, advisory.
meetings without public notice. But our board cannot have any meetings whatsoever without public notice.
Correct.
Essentially, unless we have a meeting with ourselves.
Can have
Right.
a meeting of one.
Well, I find that burdensome, and I would motion to oppose it.
I second.
Discussion by the board. Discussion by the public. Call for the vote.
Ms. Bowler,
Yes.
Dr. Bradbury,
Yes.
Ms. Laredo,
Yes.
Dr. Nunez,
Yes.
Dr. Waterhouse,
Yes.
Ms. Yanis,
Yes.
Dr. Nolan.
Yes.
Motion carries.
Things move slow enough. We don't need that.
Okay, this goes to SB 202. We did speak about it already. I provided a summary, but we did not take any formal motion. So,
Yeah, we
oh,
did.
I'm so sorry. Gosh.
Yeah, we
thank
did.
Okay, that goes to 627.
Okay, good, 627.
All right.
Do it again.
No, please don't.
Yeah, I have more to say.
Okay, 627 is allowing veterinarians to recommend cannabis. So I have had discussions with Senate BNP, just sharing the concerns raised from the prior bill, which was Colorado's bill, regarding the lack of research for cannabis products as it relates to the efficacy of animals, and the concern that there's not a lot of information out there, and I think that's kind of where I'm going to leave it right now and let the board members speak to this bill.
Okay. Discussion. Yes, Kathy.
Yeah, I just, overall, excuse me, I'm just, what concerns me in reading this and not being an expert in the whole cannabis situation is if a vet is now allowed to recommend, but they're, I think this is requiring some CE?
It says a qualified veterinarian can recommend.
Oh, qualified, and if you qualify, okay. But still, there's not a lot of data out there
Right.
for which to recommend or from which to recommend. What would happen disciplinary-wise if there's an adverse reaction to a recommendation?
Was it a qualified or non-qualified veterinarian?
Well, yeah, exactly. Anyway, I just thought it was kind of a Pandora's box, and I was a little worried about. But maybe I'm reading.
As far as discipline, I do have a concern of how it's worded. It removes the board's ability to take discipline, notwithstanding PQ and R, which is the provisions related to the financial interest. So my concern would just be related to if that recommendation was negligent and a patient was harmed. I think that we should be able to take action based on that negligent recommendation.
She's referring to section 4826.3, number C, 2C, I think, 2C1. Are you following that?
Also, by removing P, Q, and R from consideration for unprofessional conduct, this appears, if you read it in conjunction with the proposed amendment to section 4884, which came out of AB 2215 from last year, this bill would strike subdivision A from 4884 that currently says a licensee shall not dispense or administer cannabis or cannabis products to an animal patient. So we would be taking that out. I'm not exactly sure if the intent here for striking this is to authorize dispensing or administering cannabis to animals, because when you read it with 4826.3C1, the qualified veterinarian would not be subject to discipline for unprofessional conduct if they had a relationship with a cannabis licensee. So this appears to authorize the qualified veterinarian to dispense, administer, have a financial relationship with a cannabis licensee. And I'm not really sure. I just wanted to point that out because this appears to make this much broader than just recommending. It appears that the veterinarian could potentially be selling the product.
And we do have the sponsors of the bill here too, and maybe they can clarify as well. Can you introduce yourself, please?
Max McAlonis with K Street Consulting. To provide a small clarification on that point, the text law says, notwithstanding any other law, except as provided in PQ and R. So PQ and R would still apply, but they would be the only ones that apply.
That's my concern.
All right, so the concern is that they'd be the only ones. So what I'm saying is the financial interest issue would still be an issue that could be disciplined on if this bill was adopted. So it sounded like from the debate, the opposite was interpreted.
Yes, thank you for that clarification. Although it still appears that from the way this whole bill works together, the veterinarian would be the individual dispensing, administering, recommending cannabis. I mean, they wouldn't have to use a cannabis licensee. They could do it themselves.
Yeah, there's. I agree that that the removal of the prohibition on administering and dispensing would not, would be removal of that prohibition. There would not be a way without additional statutory changes for them to be included as a MALCURSA licensee. But absolutely, that prohibition does have those impacts. Removing that language has those impacts.
But does MALCURSA require a veterinarian to be a licensee of MALCURSA if they dispense or prescribe?
MALCURSA requires everyone that's going and doing a sale of cannabis and cannabis products to be licensed under MALCURSA with a state and locally licensed premises.
Right, but that's a sale. Is this treatment?
So
that's just provided to the animal patient outside of retail sale.
Right. Let the sponsors take over.
Hi, Paul Hansberry, co-sponsor of SB 627. First of all, Hi, Paul Hansberry, lovingly and legally co-sponsor of SB 627. The removal of the dispensing is not to allow them to dispense. It's to avoid, if things change on a federal level, having to go through legislation to allow them to dispense or provide if it is rescheduled. At the current time, according to Malcursa, you have to have a license as a retail license, a licensee, and it's prohibited to give away cannabis products. So the intention was that if things changed on a federal level, that they would be able to do that. We wouldn't have to undo what was done. So it undoes this, but they're not allowed to do it now anyway, according to Malcursa. Does that make sense?
Yeah, but can you tell me where under MCRSA it specifically says that you need a cannabis license for sale of animal cannabis products?
Well, it doesn't.
I mean, it would regulate it and authorize the owner, patient owner, to go in with their veterinarian recommendation and buy from a retailer who is licensed. But I'm not seeing where in MCRSA it specifically would require a license for prescribing, administering, or recommending animal cannabis.
Well, first of all, there's no mention of animal cannabis except for the provisions that were in AB 2215. Currently, it says it's for humans, and this is what we're trying to correct. Okay, so but in Malcursa, it's all cannabis and cannabis products. So regardless if it would be
for human use right now.
Understood, but what it would do it would correct the definition or amend the definition to include humans for cannabis and cannabis products for humans and animals.
But can you tell me where it defines cannabis in terms of human and animal use? I know this would provide for retail of animal products to the owner, but where would it actually regulate or oversee or require a license, a cannabis license for retail of animal use cannabis, not human use? Like, is there a definition somewhere you can tell me where it's incorporated?
Oh, maybe I can answer it this way. Originally, when we drafted the bill, there was a labeling requirement that said that it must say that this is for veterinary use only, or only to be used under the care of a licensed veterinarian. Someone walked into the senator's office and said, "What's the difference between a veterinary product and a human product?" And because of the testing requirements and because of the controls that are already in place by Malcursa, we couldn't come up with a definition that differentiated between the two. So there are no products that are legal right now for animals, so it doesn't exist. The intention of the bill is that the veterinarians would be able to, through their experience, be able to work with manufacturers to develop medicines that would be veterinary appropriate, and so that they would be able to drive the market rather than the marketplace dictating what's appropriate for animals. I think that makes more sense. So where does it say that it's for animals? It's for the products themselves are not veterinary specific yet. It would be to the manufacturers, up to them in their labeling as to where they're directing their products, and all products would be of superior quality. Now, we're talking about cannabis products here, not necessarily all CBD products. Hemp is another subject altogether. We're just talking about cannabis products here.
Right, because when I look at the definitions under MCRSA, I see like a subdivision A of 26001, this Business and Professions Code. The term A-license means a state license issued under this division for cannabis or cannabis products that are intended for adults who are 21 years of age and older and who do not possess a physician's recommendation. So then all we're going to do is just add animal patient. But where does it require an A license for?
First of all, this would be medical only.
Mm-hmm.
There's no such thing as adult use for animals.
Right. And my point is, we've got definitions for when a license is required, and all of it is aimed at human use. So where does the license, where is a license required for sale of CBD products for animals? Where is that?
It's under the retail, which can be either a dispensary, an adult use retail outlet, or delivery.
May I for a moment?
He may be able to say chapter and verse better than I.
Okay, so, like they've got growers
Right.
and manufacturers and distributors and retailers. For all of that is regulated for
And
human
testing,
cannabis.
Yes.
So is all of that going to be overseen for animal products?
Yes.
And
So to
would this bill allow a veterinarian to grow?
No.
And so I'm going to provide some background on this, some information on this. Again, my client has a comments position on this, not support, not oppose. But I'll go provide information based on the text of the bill and the text of law, if that would be helpful for the board. In the text of the bill, in section 26,000, the amendment there explicitly adds in 26,000B1 that medicinal cannabis and medicinal cannabis products for patients with valid physician's recommendations is current law, and it says or animal patients with valid veterinarian's recommendations. That's the first explicit reference in the bill, including them within the Malcursor regulatory framework. Additionally, through the additions in the medical cannabis products language, and let me go pull up. There's the animal patient definition, but let's scroll down. The amendment to section 26001AJ of medicinal cannabis is where the author of 627 will go and add in, quote, or intended to be talking about medicinal cannabis or medicinal cannabis products, also include products intended to be sold for use on an animal patient pursuant to a veterinarian's recommendation under section 4826.3.
So that was section 26001.
AJ.
AJ, that can't be. It's either subdivision A and then paragraph 1, or it's subdivision J.
No, it's the definition section. It's extremely long
Where is
definition
that?
section.
Further down.
Oh, thank you. You mean it's AJ in the
Yeah,
paren?
correct. Both A and, yes, AJ in parentheses. It's the very long definition section. And so by including medicinal cannabis products for animals in definition AJ, it then puts all of the medicinal cannabis product for animal activity under the definition of commercial cannabis activity in what would be new section L, which includes cultivation, possession, manufacture, distribution, processing, storing, lab testing, packaging, labeling, transportation, delivery, or sale of cannabis and cannabis products provided for in this division. So those sections go and place the sale, and to go back up to the previous section in the BMT code that was being struck, shall not dispense or administer cannabis. I can't speak to the administration of cannabis by a veterinarian, but the word dispense is being treated by Malcursa as the sale of cannabis. And so that limitation would be the veterinarian not being the licensed retailer, not selling the cannabis. So does this just provide some clarification on this text of the bill and such? Again, my clients have their own comments on the bill, which we need to provide further, but this is just for clarifying.
Thank you. I guess I'd like to back up just a little bit. I think we're dealing with a lot of details, and I have a fairly grave concern that we don't have appropriate research for veterinarians to recommend and administer cannabis at this point. And I have no doubt we're going to get there at some point, but I don't think we're there now. And I also have some grave concerns with the bill, the bill's wording that will make it very difficult to actually do our job to protect the consumer if they are negligent in their dispensing of cannabis. And so those are my concerns with the bill. I know Tara has others, but any other, thank you. Any comments on the board on that? Or
I as well have concerns about recommending. That's been my stance all along, and I hope that marijuana any cannabis product turns out to have medicinal qualities. If it does, I hope it's a prescription drug. As if it's medicine, it should be. The one CBD product that has been approved by the FDA is not only a prescription drug, it's a controlled drug. So anyway, I don't think that veterinarians should be recommending at this point in time without having more data, more science behind that recommendation.
any other? Yes.
So I agree that we need more research, and we really don't know what the effects are. And I think that to the consumer, I have consumers asking me all the time about CBD, and they think it can cure just about anything at this point. And I think that that's in some ways fraud to recommend it when you don't know whether it has any benefit or not. I don't really understand the difference, though, except that it's a controlled substance, between cannabis and some of these herbal remedies that holistic vets are recommending without any evidence and possibly with more harm than cannabis. So I have a little bit of issue with saying, well, it doesn't, there's not a lot of information on it. When we have these other things that are going on in veterinary medicine that we're not really addressing. I think that it's hard right now. I feel like veterinarians are being pushed in a corner and feel like they need to be able to say something to the consumers, and the consumers really want to know more. So I'm kind of on the fence about this.
I mostly have a concern upon limitations on your license, and specifically, it talks about a qualified veterinarian being the only veterinarians that can make these recommendations, and does mention that to be qualified, you have to complete a medical cannabis continuing education program. I've never been convinced that limitations on licenses serve the public in our profession, in our unique profession. It may serve it in other professions, but not veterinary medicine.
Okay, public comment.
Sorry, thank you. Susan Tibbin, co-sponsor of SB 627. Just to shed a little more light on some of the board's concerns, and all of them are well-founded. The original purpose of 627 was to correct an egregious situation, although we all acknowledge there's no recreational use of cannabis for animals. In fact, that is what's going on and has been going on prior to the passage of 64, actually, but that's another conversation. So our intent with SB 67, which is a living document, and we have not seen the final iteration, and I'll speak about that issue and amendments in a couple of minutes, but going back to the intent, as someone mentioned, I think, at a prior meeting, most patients are going to Dr. Google or their friends, or retail salespeople who may or may not have an overriding financial interest. The board expressed very clearly the lack of adequate U.S.-based studies The fact is that the studies from Dr. Manuel Guzman in Spain are robust and readily available. The studies out of Israel, which are now over 3 decades in compilation, are robust and readily available. And while most of them indeed do address human illnesses, we know that animals do in fact get many of the same illnesses, albeit demanding different ratios and different protocol. And so as we read SB 627, our intent in urging veterinarians to become qualified. Some veterinarians may decide not to incorporate medical cannabis, and that's completely understandable and appropriate. But for those who do, we see the compilation of clinical data being respectful of privacy in terms of the client, with organizations such as the Veterinarians Information Network, and sharing that clinical data. We see that as promoting the kind of research that we need, because the fact is, and I think that was mentioned by a speaker yesterday out of Davis, that federal funding is virtually unavailable for these sorts of studies because cannabis is still classified as a class 1 drug with no medical efficacy whatsoever, which is just not true.
I appreciate your comments and agree with many of them, but I do need to interrupt you because I would like Tara to clarify the point that I made just a minute ago, so that it's clear for you and the rest of the board. Can you do that, Tara?
I think the concern was why this would authorize a veterinarian to recommend the use of cannabis without any discipline for negligence or incompetence. That's specifically omitted because of 4826.3C1, notwithstanding any other law, except as provided in subdivisions P, Q, and R of 4883, which is only the conflict of interest provisions. A qualified veterinarian who makes a recommendation for an animal patient shall not be punished or denied any right or privilege for having recommended medicinal cannabis. There's nothing in there to protect the animal from negligence or incompetence. Those words were specifically added to 2215 just for discussing cannabis, but this would absolutely authorize someone to get off scot-free to recommend in any case, even if they didn't know what they were doing.
Yeah, and I defend veterinarians, but this makes me very nervous because you have to be able to discipline a veterinarian for this as much as for giving any other medication. So it's simply just not fair that this would carve out an exception for veterinarians now administering a drug which we really don't know what the efficacy is. We could argue that all week, but to discipline them for giving Baytril, it's ridiculous. So I mean, I really think, and I know you already understand that, but to specifically write into a bill that you can't discipline a veterinarian for this just is not good law at all.
The intention of that language was to give parity with medical doctors, surgeons, and osteopaths. It was not to let them get scot-off free for negligence. Now, if there's additional language we need to amend to satisfy that, of course, if there's a negligent healthcare professional, to any capacity that's being negligent, they deserve to be disciplined. So that was never the intention of that language. The language,
but unfortunately, it is the language.
But we were
from our
happy
standpoint.
to amend if that's because the intention. If it was an oversight in the language, then we apologize because that was never the intention.
Okay, thank you. Is there any further discussion or a motion from the board? I need a motion.
Okay. So I move to oppose SB 627.
Is there a second?
I'll second.
Okay, further discussion by the board? Okay, comments from, go ahead.
I really would love to see 4-way for medical marijuana to be used. And I appreciate the utter willingness from the authors to work with us to make this happen. But there's just so many concerns and so many complications as it's presented to us right now. It's difficult to support. There's just too much work that needs to be done on it.
And again, we're happy to talk to you about wording and whatnot, but now's not the time. We really need to keep moving. So we're happy to have more further discussions with you about the issues that we have with the wording.
We understand that. I have a very, very short presentation which may shed a bit more light on how we can move forward. May I read this?
2 minutes?
Certainly.
We do have, we have a motion and a second to oppose. You want to?
Well, we're open for public comment, so I think 2 minutes is appropriate.
Well, it's usually 3 minutes, but I will do my best.
Okay.
Last year, the California Medical Board put together guidelines for recommending cannabis. It should be noted that medical cannabis was approved in California in 1996. It's now 2018. The Business Professions and Economic Development Committee wanted the VMB to write a similar document, but with a specific veterinary aspect. In speaking with business professions and economic development consultants, they felt that the VMB should be responsible for developing operational regulations and consumer protections. We've been hearing that this would in fact be a good amendment to SB 627, as would the issue of discipline. We have not yet seen the final iteration of SB 627, so should you decide to go this route and investigate how this can be done, you may want to consider the recent State of California Medical Board guidelines for recommendation of cannabis. The Medical Board document could be tailored to address operational regulations and consumer protections. The language of SB 627, informed by the detailed and thoughtful Medical Board document and your expertise, as well as public input, could further consumer protections, the profession, and strengthen protections for health and safety of animals. The CE component of 627, coupled with organizational databases such as the Veterinarians Information Network, would move that needle forward with regard to veterinarians and their clients and what they actually need and want to know right now. Because right now we are looking at recreational cannabis being used willy-nilly, and let's all continue to work together to see if we can correct that situation, because there is no recreational use for animals. Thank you.
Thank you. Yes, go ahead.
I'm sorry, I know that this is going really long. I have some colleagues that have talked to me about this, and at CE events, you know, the veterinarians are packing the talks that are on medical marijuana and CBD, and the neurologists are talking about it for seizures and all of this. And is there any way we can work with this one and amend it to be more stringent so that we can still regulate it? I mean, right now it's not, there's no regulations. People are just doing this anyway, and this would start to give us a chance to potentially have some oversight.
So would you agree that we need research?
Absolutely.
Okay. I think
But
that's where we start. If you
yeah,
want to
that's
work on
not going to
something,
happen.
work
That's
on
going to
money
be
for
like,
research.
I think that the research is going to take years, and this is happening now. And we keep pushing this down the line. Like we have this committee, and we saw how long the shelter thing took. How many years was that? I mean, I guess I'm just wondering, like, at what point are we going to make a start to do something that will allow for some sort of regulation. I don't know that this is the right wording, but it sounds like we have a group of people that are really interested in trying to work with us, and they're doing a lot of the work, and is it just opposing it? Is that going to help the consumer? Because right now people are they're doing what they want in terms of like the veterinarians. I don't know.
Well, I will agree that we're putting the veterinarians in a really tough spot because you're asking them on one point to help their clients and to recommend a drug, but we're not giving them any evidence-based research to support what is safe for that consumer. So it's a really tough spot to be in, I agree. But we have to face the bill where it is right now. And we're happy to talk to you later, but the bill right now gives us very serious concerns, and I think that's what we're voting on right now. I'm sorry, go ahead, Dr. Bradley.
Oh, I was just saying that the serious concerns are that there's not enough research and that the inability to regulate it, or to go with the license.
No, there's an inability to discipline negligent action when recommending the drug, and also you're actually requiring you to be you have to be a qualified veterinarian, which is not. That's
So
not defined.
What about if we had them amend for both of those?
So if you want to handle the qualified veterinarian argument again?
Yeah, if we could amend where that isn't a requirement, the qualified. I mean, how can you be a qualified veterinarian if there is no research?
I mean, it pains me the argument that we're leaving it to Dr. Google and we have to do it fast because it just needs to get done fast. But unfortunately, we are a regulatory body that is dealing with things that are going to be the law for a very, very long time, and it just can't be done fast. And I don't think that we have the capability to fix this in the confines of this scheduled meeting right now.
Sure.
To take those issues and fix them.
Ms. Bowler.
I hate to kick it back to MDC, but MDC is finished with what we were originally charged for, and that's making those guidelines. Now perhaps MDC could work on the next step on what would be involved in allowing it to be recommended.
Kathy.
Yeah, I mean, I don't like making sausage either, which is kind of what we're trying to do here. But one of the things that, as a consumer, I'm concerned about on this bill is, again, it comes back to the lack of research that's qualified research on animals, not humans, on animals. But if I'm going to get a recommendation from my vet now, I know and believe to be true that that's based on their education, their science, all the research that's been done on that disease and the treatment for that disease. And I don't know, I think we're putting vets in a bad position since a lot of the research still isn't there yet. And I know we're under a time gun because people are using it anyway. But I also think having vets recommend something that they don't have the full background on and the full evidence-based research on animals is putting both the consumer and the vets in a difficult position. That's just my opinion on this research problem.
Is you had mentioned there's studies out of Spain and Israel. Is that not sufficient enough for the?
I think it's all on humans.
Is it all on humans, or is there animal studies?
The Israeli ones are not all human.
There are some animal studies. Pardon me, Susan Tibbin. There are some animal studies. Most of those studies, indeed, are human-based, but please keep in mind that we're looking at very similar diseases. I would also respectfully ask the chair to allow my colleague his 2 or 3 minutes. We'd really appreciate it.
He has had several minutes already, I believe. So, and I usually will try to get the board to speak before I ask for public comments again. So I'm not ignoring you. I'm trying to follow a protocol.
Thank you.
Mark?
Yeah, I actually don't. I think it's a weak argument to say that there's no studies out there because I think there are studies out there.
And do they hold any merit? I mean, are they valid studies, or are they peer-reviewed? Are they?
Yeah, well, the ones that have been done elsewhere, yes, but there's no studies that have been done here in the United States, but there's been studies done elsewhere. There's plenty of well-respected veterinarians here that are using, making recommendations for it. There's organizations online that are devoted to educating the proper use and the indications of it. So the resources are there.
Okay.
The studies are there. We just haven't used them yet.
I think Dr. Payton would argue that. I wish she was still here.
Yeah, I think
She's
she would
left.
too.
Yeah.
Because talking to her earlier, she, and Kathy was there as
But,
well. She said that no, the studies aren't there.
Yeah. The other point in conjunction with that is that many of the drugs that we use are not specifically approved to be used in animals. We have an exemption that we can use human drugs for animals because the big pharmaceutical companies are not going to pay for the studies of all these drugs to be used in animals. So it's not like we're doing something that has never been done before. Most of the drugs that we use already have never been proved to be safe and effective in animals, but we know that they are because we've used them, and there's been some reports on when to use them and when not to use them. It's similar to, the only thing that's different is that this is a controlled drug, which is why we're being extra cautious about it.
Right.
But that excuse that we're using, that there's no research, and we have to have every last possible side effect documented and noted by research that's going to cost $10 million is not a solid argument.
So I respectfully would disagree that we're not trying to get every I dotted and T crossed. I'm trying to protect the consumer, and if a product is given that we assume does something that it does in humans, or we represent it as being curative in some way, and we don't know that, that's also a consumer protection issue. Not only is the safety and efficacy of a product a consumer safety issue, but also representing the product realistically. Right? I mean, I think that's the other. Yes,
I'm
almost.
sorry.
We're almost there.
I'm sorry, but I think we do that all the time
Of course
as
we do.
veterinarians.
We do, but do you do it with Schedule 1 drugs?
I guess not. But I feel like we do it with a lot more harmful drugs that have worse side effects than what we know CBD and cannabis have. I'm not like a huge proponent. I don't think I'm actually frustrated by the use of CBD in animals. I think that it's been used as a panacea of it's going to cure everything, and I that bothers me a lot. And so I'm not like out there pushing it at all. I just feel like we're judging it differently because it's a Schedule 1, but we use a lot of drugs that have a lot worse side effects without the studies, and I guess I think that this has a lot less is a lot less likely to cause harm aside from maybe financial harm to the consumer.
Yes. I guess we have you first, and then you, sir.
It's a Schedule 1 drug federally. It's legal.
You have to hit your mic.
It's a Schedule 1 drug federally. It's available to anyone over 21 in California. So this is the California Veterinary Medicine. So this is for veterinarians in California, first of all. Secondly, again, there is no LD50 for cannabis. There are there are animals that have died from consequences. For instance, they pass out and vomit and aspirate their blood and drown, or their vomit and drown. But they've given dogs 33,000 milligrams of THC, and they can't arrive at LD50 as far as dangerous. That can't be said of a number of other holistic and herbs and pharmaceutical drugs. We have the support and letters of support from the American Holistic Veterinary Medical Association, who also sent out a call to action to all of its members to support this bill. The People for Ethical Treatment of Animals, PETA, said that they had too much on their legislative plate right now, but they would not oppose it. But they didn't have the resources or bandwidth to support it. The American Holistic Medical Foundation, the American College of Veterinary Botanical Medicine, and so on. These people are wholehearted supporters and sent letters of support. So far, we've seen no opposition. As far as the research, that's one of the main directives, so that we would have, instead of hearing things from Yelp or YouTube videos, or the lady down the street who has the dog that the crazy hippie, we have documented medical reports from veterinarians that's reliable from healthcare professionals as to the efficacy that this worked, that worked, the other worked, and would give good hard data for the next a very expensive and time-consuming clinical trial, so that they would have hard data. It's if this worked for irritable bowel syndrome, then this, well, maybe we should do this clinical trial because we're having success with this within the profession. Further, this is the document that Susan was making, the guidelines for recommended of cannabis for recommendations from the California Medical Board. They have a chain of command of when to do it. If other pharmaceuticals the treatments are working, then you don't recommend. And then it goes on. This could be modified should you decide to, but it seems to me that this could be modified to veterinary use rather easily. I mean, there are some things like a history of substance or psychiatric substance abuse would be a precondition of not recommending. But it could be modified, like as I said, very, very simply if you wanted to do that. The recommendation of this, and most importantly, we still haven't seen the summary from the Business Professions and Economic Development Senate Committee consultants. It still hasn't been written as of this morning. And there will be amendments. One of the amendments would be something along the lines requesting the board to develop these recommending regulations for consumer safety and for how they would recommend. The issue of the discipline, and I apologize for that, that was unintended. It was never intended. We thought that the disciplinary action was already in place, and all that was doing was giving parity to the veterinarian with the osteopaths and medical doctors. This was never an intention to usurp your power. This needs to be done legislatively. You don't have the power to include this in Malpersa. So the reason that we did that was so that we could work together and send it through as amendment. These laws never are exactly as they're written out of the gate. They get amended as they go through committee. So I would strongly urge ask for your support. But if we can't get your support, I would ask that you at least wait until we could see the bill and watch it, so that we can see and work with you to amend it, so that it can be a benefit for the consumer, a benefit for the profession, for the veterinarians, and a benefit for the patient. Thank you.
Thank you.
I'll just start by thanking you for the very robust discussion that you're having over this motion on this topic, and appreciating the comments made, and also appreciating the comments, especially from Dr. Bradbury, recognizing both the interest of veterinarians rank and file in this topic in conferences, and truly, as we consider the proliferation and existing access to these products, and that if we're taking the consumer protection standard or consumer protection perspective on this topic, the products are out there, and my client makes one product that is licensed, tested, taxed, and regulated, which we believe is the proper way for this to be done. But that being said, these products are out there, they are ubiquitous, they are currently being used with or without discussion from the veterinarian. I want to focus my comments on two particular points. The first being that the Epidiolex was just approved by the FDA last fall. That was placed on Schedule 5 alongside Robitussin AC and codeine-containing products. That is not the Schedule 1 drug that cannabis has been much maligned as. It is the lowest schedule by the DEA. So I do want to go and say that, especially for products that are CBD-focused, such as the ones my client creates, there has been a determination, at least for the pharmaceutical industry created product, that is on the low end of scheduling risk. Secondarily, I want to just briefly discuss, and I mentioned at yesterday's comments on 2215, the term recommendation here, again, harkens back to the recommendation of a physician's recommendation, and in that case, and in this case, it's referring to the ability to access the licensed retailer. In the case of a medical recommendation under Proposition 215 for human medical cannabis, the veterinarian will, the physician will give a recommendation. There'll be a written piece of paper saying that you are qualified under one of these diseases or a generic catch-all, or another section, and then that is what allows you to enter the medical cannabis dispensary. The use of recommendation in 627 additionally goes and allows for individuals with that veterinarian's recommendation to access the licensed dispensaries. And so I understand that there's a lot of questions about impacts on the veterinarian recommending cannabis and potential negative impacts if they recommend cannabis and something goes awry with that. I'm not... I definitely appreciate the impacts of that, but I just want to focus on that term recommendation. Is this bill would allow veterinarians to enable folks that want to buy cannabis for animals to be able to walk through the door. That is the primary impact of the veterinarian's recommendation in this bill as it pertains to Malcursa. Now,
It's not, it's gonna read.
Can't they already walk in the door?
Yeah, they can already walk in the door.
Purchase cannabis for use on their animals?
well,
Right, but it's still
But it's on the
cannabis.
shelves
They're
in
walking
the
through the
dispensaries.
door. I'm
no,
saying it does more than just allow them to walk through the door. It allows the client to receive information
Recommendation.
based on a professional opinion about the use of a Schedule I drug on their animal. That's what it does as far as this committee goes.
Okay.
It's not just walking through the door and getting access to the drug. It's information about what is the best product for use on this animal. It's a recommendation.
So I appreciate, I don't want to be rude to our public people. I feel very strongly that that's important that you have your voice, but we have other people in the audience that have come from a long way to talk about their subject as well, so we really need to move on. I appreciate your input, though. Can we call for the vote? Or maybe we better review what the actual
The
motion.
motion is to oppose SB 627. Ms. Bowler.
I'm telling you, we're going to change your last name.
Start with the other way.
Dr. Bradbury.
No.
Ms. Laredo.
Yes, and I wanted to comment on my yes, because I know how it feels to work on something and have it shot down when you put your heart and soul into it, but this is too big of an issue to rush, and we spent a great deal of time at the MDC committee discussing allowances to make it okay for a veterinarian to discuss it, being very careful not to hinder on recommend, and this is just too big to rush, so yes.
Thank you.
Dr. Nunez.
Yes.
Dr. Waterhouse.
Yes.
Ms. Yanis. No. Dr. Noland.
Yes.
Ms. Zoller.
Yes.
Motion carries.
Would the board be interested in referring this topic back to the MDC? And this is not specifically to develop the guidelines, because we already did that, but to work on the next step on what would be sufficient in the veterinary medical board's mind for a veterinarian to make a recommendation to prescribe cannabis. What criteria must be met for the board to be comfortable with it?
I think it's a little premature.
It's an issue that we can't ignore. We have to do something about it.
I agree, it's an issue we can't ignore, and I think it's going to come back, and we're going to have to keep talking about it, and it's been a robust discussion, and we need to continue to have a robust discussion. And again, I'm going to probably get my counsel mad at me, but we're happy to keep talking. We're not trying to stonewall you. We're happy to keep talking and sharing our concerns with you. But I agree with Jennifer. There's too many concerns on a very short time frame for us to be comfortable with it. At least for me to be comfortable.
We're giving plenty of reasons why we oppose it. We need to give what conditions need to be met to satisfy it.
Are you making a motion, Dr. Nunez?
I am making a motion.
Okay, what is your motion? Would you mind specifying it?
To refer the matter to the MDC to define which conditions must be met for the board to approve or endorse the recommendations and prescriptions of cannabis products.
Okay, a second?
That.
A second?
I second that.
Okay. So the motion and second has been made. Call for the roll. Oh, discussion. We need to have further discussion. We don't have time. I can't be rude to the rest of the audience here. I mean, call for the roll.
Yes.
Thank you.
Yes.
Ms. Laredo?
Yes.
Dr. Nunez?
Yes.
Dr. Waterhouse?
No.
Ms. Yanes?
Yes.
Dr. Nolan?
Sure. Okay. Okay. We're going to go ahead and move down to number 12, update, discussion, and possible action regarding the administration of the California Veterinary Technician Exam, the CVTE, and after which we will move on into the drug consultation, number 9 on this. So we'll do 12 and then 9. I'll turn it over to.
Sorry, we're checking.
I promised it would be done by. Yeah.
Okay. So this was briefly discussed at the last meeting, and there were concerns raised regarding cost of the RVT exam. At that time, we were looking at if there is an issue with the exam, what AAVSB may be able to do to combine the exams into one. And so I agreed, as the board requested, to reach out to AAVSB and have that dialogue. Prior to me having that dialogue, though, I needed to have a better understanding of what the RVT exam is and what the statute requires. So I did quite a bit of research on the RVT exam. I reviewed the occupational analysis and Lincoln study provided by OPES. I reviewed the specific statute that requires the RVT exam, and I also looked at the specific questions and answers on the California RVT exam. I have, as we all, I believe, do, a strong understanding of what a license is for. A license is absolutely a barrier to the economy, but it is intended to protect consumers, and it is necessary. But I believe that we need to look at the requirements to make sure that it's not, that it is the most efficient way to protect consumers. And that starts with the legislature. They determine through statute what is the minimum competency and requirements in order to protect the consumers, to provide that barrier to the economy. And in statute, the legislature has deemed it necessary for an RVT applicant to pass the national level national exam, that's the VT&E, and an examination specific to the animal healthcare tasks limited to California registered veterinary technicians as approved by the board. So with that, I believe the first thing that we need to do is look to see if there are California tasks limited to California. And I have not been able to find any tasks that are limited to California. I do understand, and I provided a memo from OPES with concerns as it relates to eliminating this exam. They believe that there is a gap in the national exam and what is being performed in California. And so they have concerns that if you eliminate this exam, consumers will be at risk because RVTs will be doing tasks without being adequately tested on. I also shared those concerns with AAVSB, and they graciously agreed to come to the board and share that. They also, though, did a comparison of their exam and our state exam outline and provided information, which I provided to the board members and also is online. I think that we have, by we I mean I have fundamental disagreement with OPES as far as what the California exam is. To me, if you're looking at an exam that's supposed to test on tasks or gaps in practice, then anybody, let me back up. For the state exam right now, if you have the statutes and the regulations in front of you and you take this exam, I believe anybody would pass. I believe it's a test on statutes and regulations. Yes, they're on governing the practice in California, but it is on the statutes and regulations that we're testing. And I believe that is no longer, that is not what 2 is, what the legislature had put in place. Unlike veterinarians, where they are specifying the national exam, the California exam, which OPS does, and then a jurisprudence exam. That third requirement is not on RVTs to do. And so I do not believe this exam is meeting the requirement in statute. However, OPS is taking the stance that Business and Professions Code 139 gets us there. They specifically say in the memo that I provided to the members and also for public comment, they say that in review of 139, they believe that if the review indicates that California practice is not sufficiently assessed, a supplemental examination should be considered. Their view is that's what allows the board to then require this exam. I don't think it gets us there. I think it allows the board to then consider other options, but then we would need a legislative change to put into our Practice Act to require RVTs to do that. So with that, the board does have an option to no longer approve the current OPES exam, the California RVT exam created by OPES. If they did that, then it would no longer be required. However, if the board believes that there should be an exam that tests on the statutes and regulations, then perhaps we can address that through sunset and ask for a legislative change. There are other ways to get there, though, if the intent is to make sure that RVTs know the statutes and regulations. And when you look at the exam, as I did, 24% of that exam was specific to one regulation, which was 2036, and the scope of practice essentially for an RVT. And so if our goal is to make sure that they know their scope of practice, you can accomplish that by providing that to them, by having them attest that they know, understand, and will abide by the statutes and regulations as it relates to their practice. So with that, I did invite AAVSB to come and speak. I know we have a number of RVTs as well, but if you want to open it up to the board to discuss.
Okay, so board member comments?
I'll wait for the presentation.
Okay, then I'd like to invite the public to comment and the OPES representative.
AAVSB.
Oh, I'm sorry, AAVSP, that's right, I'm sorry. I thought OPS was here, hold on. What's her name? Yeah, thank you for coming, Nancy.
You're welcome. Thank you. Nancy Gritman with the American Association of Veterinary State Boards, and it's my pleasure to be here and participate in this. And do want to thank the California State Board for the volunteers that you have from your board participating in many of our committees. So I do want to make that public comment. So yes, when your executive officer asked us to review the job task analysis that was completed in 2017 and finalized with the new blueprint for the VT&E and first administered in July, August of 2018, this past year, we asked our exam vendor, which is PSI, to specifically look at the analysis in comparison to California veterinary technicians who participated. That is initially in the analysis study that was provided, dated March 2019, that is available. So in the results of the comparison, and I won't go line by line for the analysis, but want to try to give an overall synopsis of that. With the results of the comparison and the data collected for veterinary technicians practicing in California versus those practicing in other jurisdictions across both the U.S. and Canada, providing statistical evidence that there were no significant differences identified between the two groups of responses on the survey questions in regards to ratings both on the frequency and importance of the job tasks performed by veterinary technicians. Both groups of survey respondents considered the task list to adequately cover what a veterinary technician would do in practice. And providing support to the content validity of the VTN exam, that the exam content outline developed from the 2017 survey is both adequate and appropriate to be used for the exam construction initiatives for the VTNE. I would also state that in the time that the AVSB has completed the last two job task analysis, the one prior in 2011, prior to California utilizing the VTNE, the AVSB has had a California RVT representative, not only from the California board initially, but with our subject matter experts. So we work very diligently to ensure that in our exam development, exam construction, item writing, that we do engage California subject matter experts, those that are veterinary technicians in the state. So this is a summary of this analysis, again containing data comparison. Various appendix gives sort of the certainly the demographics, and that they are very similar from California candidates to others. If you look at Appendix B and C, containing the data comparison on a comprehensive list of tasks that are performed by veterinary technicians and asked to rate the frequency in which they perform the tasks. Again, the data was very much aligned between the California veterinary technicians who participated in the survey and those of US and Canada. Appendix D goes on to also look at containing the data comparison on the 9 areas of the practice, and we're asked to provide percentage of time spent and patient harm ratings to each of those 9 areas. And so again, with the analysis that was done, and if you've had an opportunity to review that, the data does certainly support that the VTNE is representative of not only California, but certainly all across US and Canada. The additional narrative that was provided initially on April 2nd, the AVSB asked 2 subject matter experts who have been involved in previous job task analysis, VTNE exam development, and are knowledgeable of regulatory policy to review both the VTNE blueprint with the previous 2000 California RVT and the 2018 California RVT exam outlines. In completing the analysis, as indicated, with the comparison, again, feel that California statute laws are perhaps the only content areas not covered quite adequately. However, that the practice content areas, the clinical practice content areas, are covered in much greater depth and detail by the current VT&E blueprint. That was the conclusion of the subject matter experts that we engaged to review both the 2016 and the 2018 exam outline. And in conclusion, indicating that the current VT&E blueprint certainly adequately covers the clinical practice tasks and knowledges of the CARVT 2018 exam outline in determining minimal competency for veterinary technicians. On April 4th, in response to an additional request, the two subject matter experts provided a more detailed outline to support the current VT&E blueprint. And as indicated in the outline on that narrative, again, identifying both domains of the VT&E tasks and knowledge statements that would adequately cover the some specific tasks that were in question as far as induce anesthesia, euthanize animals, extract teeth, and close incisions. So again, the subject matter experts that we had review feel that these specific tasks that were in question or of concern are currently and or can be more extensively covered under multiple domains as noted above. So that summarizes information.
So when you say can be, is there an additional cost to making sure that happens, or is this something that's fairly easy to do? And
yeah, what certainly in the item writing and the exam development, we would ensure that you know, in the VT&E blueprint, that we would be able to adequately cover those. And as indicated, you know, veterinary technology students currently receive instruction on many of the components of these tasks in AVMA, CVTA, and CVMA veterinary technology programs. So, and do recognize there is variance from, you know, state to state, but we feel that it can be adequately covered. In fact, we have a item writing coming up in June, and so certainly will, as we continue to do, engage a California subject matter expert of which we do have involved in that upcoming and have continued to do throughout exam development to ensure that we are covering everything adequately, as we do for all of Canada as well as U.S.
so any questions?
Just a clarification. Are there in California, for California, are there certain activities that RVTs can do legally here that they do not do in other states? And if so, and is it extraction, dental extractions? And if so, are those things that we would need to add to VT&E for sure?
So in my research, the only one that I was not able to confirm that another state is doing is dental extractions. But with that said, there's some wording in various other practice acts, such as Virginia, where it may be, but I'm still doing that research. I think that the big difference, though, is addressing a gap from the national exam on the practice versus what the statute currently says. So there's to me, they're two separate issues. If we want to address a gap in the practice exam, then we can work with AAVSB to address that gap. But right now, the California exam as it stands is not going to test on practice areas, what to do, what to monitor when you're doing a dental extraction, what to do when it goes wrong. It's what the statute and regulation says.
Cheryl. I was looking at Kathy and I hit on the shoulder.
So I have a question on this one-page sheet that's dated April 4th, where there's a chart, and the third one down says extract teeth. That has the VTNA or VTNE task. So are you saying that you already have questions on extracting teeth? Is that what this is saying?
There currently can be more extensively covered. So there may not at this time be specific questions, but certainly that's something that we will address, and the subject matter experts that reviewed indicated that we would be able to cover specific areas of that.
So what do these numbers and letters represent?
Those are areas where in an exam, construction, exam development, every item that you have included on an exam, you have to note a specific domain, task, and knowledge statement. So these are, and perhaps not exclusive, but these are domain, task, and knowledge statements that could be identified for the specific items being
Okay, so I'm just
asked.
trying to understand. So like the 16 through 23, then that could all relate to surgical nursing and not extraction, not dentistry. Is that?
Extraction of teeth
it says
can
extract
be
teeth over here on
covered
the
in
left.
surgical nursing and or dentistry. It can depend on how the item is written, what is being asked on that specific item and specific tasks. So that is when, during the item writing and exam development, the subject matter experts initially identify what task, and it goes through multiple reviews until it's finalized. And so that then supports, obviously, the blueprint as you're constructing the exam.
Okay, so just to be clear then, so you probably don't have questions on how to extract teeth or extracting teeth. You could add those, but that's right now they're not there. Is that what you're saying?
Yes.
Okay.
Sorry, Mark.
So I think that the job analysis survey is probably one of the most important tools, if not the most important tools, that we have to ensure consumer protection.
Correct.
Because our field of medicine is constantly evolving. This job analysis survey goes out every 5 years to survey exactly what is being done in our veterinary hospitals and other locations where veterinary medicine is practiced. And then the results of that is magically transformed into a test, an examination, to ensure that the graduates of educational programs know these skills and are able to perform the skills at an entry level. They're not expected to put out a specialist or a board certified person. It's just what an entry level licensee is expected to know. So if I were to hire an RVT on their first day after graduating RVT school and passing the exam, I probably wouldn't expect them to know exactly how to extract a tooth. But there are certain things that I would expect them to know as an entry-level person. Based on the report that was provided by AAVSB, you can see all the areas of practice that occurs in the hospitals, and the job tasks are similar. when you compare California to the rest of the nation. So I believe that if you pass the VTNE, in my opinion, you are sufficiently trained and examined to serve as an entry-level RVT, with the exception of the regulations, the California statutes and regulations and radiation safety guides, which is not necessarily something that I need to go to a 2-year or 4-year program to learn how to do. You just look it up. So I don't think that there is an urgency to establish an examination to make sure you know all the regulations properly. And that seems to be the only thing the CVTE is accomplishing right now.
Okay, Jennifer.
So in the interest of time, I think the rest of the board knows where I stand. But I would like to hear from some of our guests. I think the biggest issue to this, I initially brought this up because of the concerns with cost of the exam. The concerning thing that I see is that the examination that we're administering does not meet legislative requirements. That is a huge concern. So I'd like to hear what suggestions are from others who are not me.
Okay, I have Dr. Bradbury first, so.
So it sounds like on our exam we don't have anything on dental extractions anyway. Am I correct on that? On our
Which exam?
on the California one, because it says it really exists.
So to clarify, I think that there's if you were to see, and then this is assumption A, BSB exam questions, you would not be able to point to a statute or a regulation in order to answer that question. You have to rely on the training that you were provided. The questions on the California exam, you don't necessarily have to rely on that training. You have to rely on what the statutes and regulations are. So while they might have questions specific to dental extractions, it's not on how to do it.
It's about the law.
It's what the statute and regulation says.
Okay. So it sounds like we really, I liked your, if a proposal is made, you recommend the same administration method as a current veterinarian jurisprudence examination. So basically, thank you for all of your work, by the way. That was a very comprehensive analysis and very helpful, I think. But it sounds like just moving to that would make the most sense and save us money based on that $50,000 annually that we're spending.
Okay, other members of the public? It looks like the board.
Nancy Early, California RVT Association. I feel that the OPES is being a bit disingenuous with us at this moment. When the VTNE was first instituted, they did an analysis of the test plan of the VTNE and came away and said that the only thing missing from the VTNE were California laws and regulations. And so the exam that had been administered from the very beginning and until this year contained nothing about job tasks other than the laws and regulations about practice of RVTs, which was not required by law. During the last revision or practice analysis, they came away with a different conclusion. They looked at the VTNE and the California exam and decided that it was missing. The California exam was missing some job tasks, although according to the AVSB, that's probably not accurate. But they changed the exam and put some questions on the exam that, in my opinion, are really, I've not seen the questions. I don't know what questions are in the exam, but I've seen the outline of the exam. I personally have written the study guide for the exam, so I'm very familiar with what the exam outline is. And there are areas on this, at least one area requires RVTs to know about reportable communicable diseases. There's actually 4 pages long of communicable diseases that are supposed to be reportable. And then I looked up the actual law, and the people who are required to report these communicable diseases are many, but not one of them is an RVT. So there's 4 pages of requirement knowledge that for this examination that are actually not required for RVTs to know. So I'm not confident that the review that the OPES has done on the VTNE and our exam are truly accurate. But then when you get to the jurisprudence, which is the only thing that was missing from the VTNE, of course we could do a mail-out exam that California does for some veterinarians in the state. There's actually an exemption in the Practice Act for students of UC Davis and Western because they've taken a jurisprudence course, so they do not have to take the jurisprudence exam. Well, I can tell you that every approved California program for RVTs also teaches jurisprudence courses. So, because I've checked. And so I don't see any reason why California RVT candidates need to take a jurisprudence exam because they take the same course that veterinarians are taking, and they are exempt. So I think if we're going to do a regulation, we should exempt, or if we're going to change the rules, we could exempt California RVTs from having, or students who graduated from a California program that includes jurisprudence from having to take a jurisprudence exam, but we could have a mail-out jurisprudence exam for people who come from out of state, or we could go with the way some other states have gone, which requires an affidavit that says that the person has familiarized themselves with the laws and regulations and that they promise to obey them. And I have checked with Sue Garanon, who's a previous executive officer. At least in her opinion, such an affidavit would be adequate for disciplinary action if a person violated the regulation and they signed an affidavit saying that they knew what the regulation was and promised to obey it, and if they didn't, then they would be subject to discipline. So and of course, you realize that this all came up primarily because of the cost. It's RVTs, as you're all very familiar. At best, it's not a high-paying profession, and when these students are already graduating with a large debt from going to RVT school, and we hear over and over again from directors of programs that they have students who go through the program, and then when they get to the end of the program, and then they're confronted with another $800, or it's actually now it's $675 to take the licensing examinations, and then when they look at how much of the license is, another $150, they go, oh gosh, I just can't spend another penny, and they don't take the licensing examinations. We have a shortage of RVTs in the state, and we are actually causing a shortage by requiring an examination that's not really testing things that need to be tested. So if we could eliminate this California RVT exam, it would save the candidates $200. It would save the board $50,000. And it just seems logical that we're testing people on things that the jurisprudence part, they've already learned at school. Veterinarians are not required to take the jurisprudence exam. Why are we requiring RVTs to do so? And the one or two job tasks that they're now throwing onto the California RVT exam just don't justify the expense.
Okay.
I just want to add one point of clarification. I do appreciate you reaching out to the former executive officer and her comment as far as whether or not it'd be sufficient adding the attestation. I would like to clarify, though, for discipline, there's not a current requirement for RVTs to take and pass the statutes and regulation exam. However, if they break the law, we can take discipline. So it's currently sufficient to not test them on statutes and regulations because we can still take discipline to this day without this requirement.
Okay, great. Thank you, Nancy. Anyone else would like to come speak?
Maybe just perhaps some comment that would be helpful in looking at other regulatory boards.
I'm sorry, can you speak closer to the microphone?
Oh, sure. Just to add comment, as far as other regulatory boards, specifically in the U.S., there are very limited number that do have a jurisprudence exam. More so do not have a jurisprudence exam.
Thank you. Yes.
Leslie Boudreau, CARFTA. Just 2 points that I'd like to make. One, CARFTA has a financial interest in continuing the California state exam because we publish the only study guide. However, CARFTA would gladly give up that revenue because we really feel that this test should go away. Originally, in fact, the test that I took was the California specific test before we adopted the VT&E. And at that time, there were no statutes or regulations as part of that exam. So I'm not sure how that came to be that we have a statute and regulation examination presently when many RBTs that are currently in practice never had to take that. And then my second point is from the standpoint of in practice. And as a practice manager, I have a staff of 50, we have 10 RBTs, and we have 7 veterinarians. And we're on a continual basis trying to get veterinary assistants to go through RBT school. And it is a financial burden to them to the point that before we compensated them after completing school and after taking their tests and their license fee to make sure that they did pass and that they were able to be licensed. However, I've had to change that in that I have to compensate them ahead of time because they cannot afford the cost. They literally are living at, even with I feel we provide very fair wages at my practice. However, it is still out of their ability to have that discretionary income to pay for those costs. So we do pay for that now in advance. But I know just from communicating with other practices and talking to the teachers of the students who come to intern in my practice that most practices do not cover this cost for the students. So we do, but we've had to change that to make sure that they do attempt to take those tests. Thank you.
Hi, Jennifer Bench. I'm the program RBT and program director at Platt College. So I'm trying to get them out there for you. I do want to comment on a couple things. I will make it very short and sweet. I agree with Dr. Nunez when he talked about the radiation safety. We do it in school. They were required to pass the radiation safety test in school in order to pass that class. So that part of that exam can go away. So I am all for taking out the California portion of the exam. When it comes down to finances, the amount that it costs for a student when they are, they've graduated and now they're paying back loans, in order to take the exam and become registered, it's half of their month pay. I mean, that's not counting life, life expenses, but it is half of their month pay, and it's just they can't afford it. We have, I do have the benefit at my school where we are offering to pay under certain circumstances. We are offering to pay for at least the national exam, and so that way we do have students that are able to, at least are only having to do the California exam. But with the lifespan, with resources of study resources and things like that, it's over $1,000 for them to become registered in the state of California. And if we can cut that almost in half, that would be fantastic. I think if we did decide to do that, I apologize, I don't remember who had said it, but doing the online exam similar to what the DVMs get to do for people that are coming from out of state, because I don't really necessarily want to put California questions on the national exam, seeing that people coming from out of state will then have to take another national exam. I wouldn't want to do that either. So making it so it is specific for just people that are coming out, I think would be beneficial.
Thank you.
Thank you.
Any other public comments, or it looks like Dr. Nunez?
First of all, in regards to the comment from the AAVSP, is that very few states have a jurisprudence exam. Nobody has more laws and regulations than California. So we need to have an examination. Is an examination specific to California statutes and regulation the same thing as a jurisprudence exam? Are we defining that the same? Okay. Then
we don't have that requirement.
What I would propose is eliminating the CVTE, and in order to address Jennifer's concern about us not meeting what's in statutes, that we propose through legislation as part of the sunset review process a way to administer some sort of online examination or mail-in examination or something different than the current CVTE.
Is that a motion?
It is a motion.
Would anyone like to second that motion?
I'll second it.
Okay. Discussion?
So I want to clarify. So you are suggesting this for all candidates, not just for those coming in from outside of California?
Yes. Well, it would make it similar to what they're doing with the DVMs.
No,
Um,
I don't think you heard the comment.
But can I?
Yes,
So
Cheryl.
I know. Yeah, I know you know.
Just kidding.
So some of these RBT candidates are from online schools, or have alternative routes of getting there. So I think taking the jurisprudence exam would be a good thing.
so they would be California residents just getting their education outside of California via online.
So some of these are online.
So I'm going to jump in and make a comment. Registered veterinary technicians are supervised by veterinarians. I think that it's important that they understand what the rules and regulations are, but we're not held to the highest standard as a veterinarian is. So I think requiring them to take a test, especially since they've had that schooling, most of them is a bit onerous, including the fact that we have the ability to discipline them right now, and I'm not sure that taking an online jurisprudence test is going to affect the safety and protection of the consumer. I would, if you want to do something, I would just probably do an affidavit if we have to do anything.
Actually, hearing those points, I probably would be in favor of just an affidavit.
I
think it would be sufficient.
Well, and let me just ask this question of Tara and Jessica, but can you just provide them the rules and regulations when they apply for the license, or the ones that are relevant to them, and then say, have you read these and understand them? I mean, can you just do that?
Yeah, you'd have to do it by legislation or regulation.
Through Sunset Review, could we?
Yeah, I would recommend doing it through Sunset Review if that's what you want to do, because justifying an affidavit under penalty of perjury that they've read the California statutes and regulations it's very difficult to get something like that through OAL.
And I would suggest we mimic what we do in the veterinarian's license and just require it for those that are out of state that are not educated in California.
I just want to make it very clear that when it comes to consumer protection, if an RVT violates the law today, we can absolutely take discipline. So adding requirements that don't add to that ability to take discipline, I think should be carefully considered.
So what are you saying?
Can we just?
What do you think of the jurisprudence exam?
I believe that it's adequate as it is now, without requiring an exam on the statutes and regulations, because if they were to break the law, we can take action.
Yes.
And to be clear, there's nothing in the statutes, in the legislation, that says that we have to do a separate exam. So we could just move to administer the national exam, ask them to maybe adjust it a little bit, and be done with it.
So to clarify, there are 2 examinations listed in statute. My belief is that the second one, the one limited to California only tasks, does not exist. And even if they do, this exam that we're currently providing is on statutes and regulations. And so I'm not saying to change how that statute is written, because there could be a time where there are more tasks. And this, leaving it as is, would allow the OPS and the board to create an exam. But that exam should very much be able to be tested on the knowledge of the practice on how to do that task, not necessarily on the statute or the regulation.
So what can we do that's simple and straightforward here?
So the examination right now is as approved by the board. If the board determines that this examination, one, that how it's written is not, it doesn't exist as far as limited to California, the board can unapprove, and Tara, correct me if I'm wrong, unapprove the examination. That would mean as of after that motion, they would no longer be required to take and pass this exam.
I motion to unapprove the California test.
I second.
So I should withdraw my motion.
Yeah.
Dr. Nolan, I think we have one more public comment.
Mm-hmm. Oh, I'm sorry. I apologize. Yes. Name?
Sorry for the late introduction. My name is David Uridia, RVT. I also participated on the occupational analysis. I served as a subject matter expert for the question review for the California exam. If I could just make it quick, one suggestion I would say you might be interested in is maybe a free continuing education class that would require or produce some kind of certification or certificate that would be required for license renewal, maybe, but could avoid an upfront cost for these new applicants. Oh, I'm sorry. For the to be more specific, the regulations and the laws, essentially.
Mm-hmm.
The problem with the second motion is that it doesn't address those concerns about knowledge of the rules and regulations. But if we decide as a board that we don't really care if they are knowledgeable about rules and regulations.
Would you like to amend her?
But let me clarify the motion that's not what we're saying at all. We're not saying that we do not care that they don't know the statutes and regulations. What I'm saying is when you add a requirement, which is additional barrier to license, you have to look at the consumer protection benefit to that. And what I'm saying is, without any additional requirements, they know the statutes and regulations, we already to this day can take discipline. So we need to have a justification for adding an additional barrier to license for how it benefits consumers. And what I'm suggesting is that any additional requirement for this, we're already protecting consumers.
Kathy?
Doesn't it, I'm not arguing for an additional exam, but doesn't it actually also protect RVTs as consumers to know what the laws are? I know we can still discipline them, but isn't the test on laws and regulations useful?
So they are probably, I would guess, tested on this in their schooling.
In California, apparently.
In California.
They are.
And then if they come here and are applying for a license, they're required by us to know that. And if they don't and are, and the veterinarians they're working under are supposed to know this as well, I guess. So we can still discipline them on that. I think that adding barriers to RVTs getting licenses is actually hurting the consumer because right now we have a huge shortage and we're trying to encourage people to do this and we just don't have them. So
Sure.
So I still have a question about the online RVT schools, which could be originating outside of California. Do you know, Nancy, do they talk about California jurisprudence, the online schools?
Which Nancy? There's two.
Yeah, there's two. Okay, sorry. Either one. Anybody that knows.
Nancy Square.
Well, are you talking about AVMA approved schools or are you talking about the alternate route programs? Because
well, we have that too.
Yeah,
so
we have alternate route programs, and of course we are now going through the process of eventually we're going to be accrediting alternate route programs, and as part of their curriculum, they offer jurisprudence just like any other RVT program. The AVMA approved schools, I presume that they have the same curriculum. An AVMA approved program, whether it's online or it's in a classroom, has the same curriculum. So, I mean, I think it appears that you're not interested really in writing any new legislation, or but perhaps through sunset, if you want to put in the same exemption that veterinarians have, that they don't have to take a jurisprudence exam if they have taken a course in jurisprudence in their program. That could solve that problem, so that you're assured that everybody has had a jurisprudence education. But when I was researching this issue, I contacted most of the RVT programs in California, and they do teach jurisprudence. And in order to be an approved program in California, it's part of their curriculum. I can't guarantee that an AVMA program that's it's in New York has California jurisprudence as part of it. It would be the same issue as someone moving from another state. But I think the affidavit issue would take care of it. If you can print out, have a small pamphlet that contains the regulations, laws and regulations that control the practice of RVTs, and have a person sign that affidavit, and it's pretty simple.
Dr. Nunez.
Okay, I'm liking your motion more, because if we unapprove the CVTE for the reason that there are no California-specific tasks that are different, so it doesn't accomplish it, so we unapprove it. But we don't do anything differently. We still leave the door open for the possibility of sometime in the future of California job-specific tasks. We still leave that door open. We don't close it completely. And as far as rules and regulations, as you stated, we already have the ability to discipline violations of that. And the teaching of those rules and regulations is part of the accreditation process of an RVT school. So everything is covered.
Okay, so we have a motion, I believe, and then we had a second from Jennifer. You're saying you agree. Any other discussion?
Could you restate the motion?
Yes, the motion is to disapprove the California RVT exam as a requirement for licensure in California. Is that the motion?
I think we just need to clarify it in that it's the examination that's currently being administered, because we want to leave the door open in legislation in case there's a time that California RVTs are doing tasks that other states aren't. We could then bring the RVT exam back, but today the exam that's currently administered does not fit the requirements under that statute. So we're just unapproving the examination being administered today in California for California.
So glad you're here to help us with that, yes.
She said. So do you want me to withdraw my initial motion first?
Would you mind?
I withdraw my initial motion.
Okay, and that means Alana needs to. Okay, so we have a motion that Tara clarified, and then we had I believe, second with Jennifer. Can I add just one little caveat, and that is I would like to direct our staff to make sure they continue to work with the AAVSP to make sure we do have pertinent coverage.
Absolutely.
Okay, should we add that to the motion, or? Okay, good, okay, so we have a motion, second. Any more discussion? Anything from the public? Okay, call for the vote.
Call for Jennifer first.
Ms. Bowler?
Yes.
Dr. Bradbury?
Yes.
Ms. Laredo?
Yes.
Dr. Nunez?
Yes.
Dr. Waterhouse?
Yes.
Ms. Yanis?
Yes.
Dr. Noland?
Yes.
Motion carries.
Okay, can you explain what this is going to mean? Is it starting tomorrow? You don't need to take the exam?
Correct.
Okay, and then what's going to happen to Susie, who took the exam yesterday and failed?
I mean, it's forward.
She reapplies?
Tara?
Yeah, I think we need to make sure that this is a prospective decision. It does not apply to individuals who have previously taken it, but apparently with this decision, it sounds to me like Susie, who took it yesterday and failed, would not have to take it again now.
Correct.
But what about Susie, who took it a year ago and failed?
So, as it stands, how
So
that
anyone
would
who
work
passed the VTN in
that-
the last 5 years is eligible to be.
So what we will do internally, staff-wise, is we will look at those who have applied, and if the only thing that's holding them up is this exam, we can contact them and let them know of the change so they can apply and not have to do this exam.
But it sounds like they'll have to reapply if they were denied. It sounds like.
Depending on if the application itself is abandoned, but if it's currently an active application and they have failed this exam because it's no longer a requirement, then they would be licensed.
So I think it would be helpful if you could explain what an active application would be, how far back that would go. I mean, the candidate wouldn't have abandoned it. They would just assume that they didn't qualify.
There's various reasons why applications are abandoned, but it's my understanding after a year.
So basically anyone who a year ago.
But I think there's more work we can do internally of how we're going to implement this and have these RVTs join the job market.
Okay.
There is a statute on how long ago you passed your national.
Right. Yeah,
Yeah,
5
years.
It's 5 years. Okay, thank you very much. And moving right along.
Could I also thank the AVSB for doing such great work on the comparison?
Yes.
Your subject matter experts, that must have taken a lot of time, and the reports you produced were very interesting.
I do also want to thank OPES because
And OPES.
I am not doubting the quality of the examination. I think that you do an excellent job. And I really appreciate their work and their willingness to get us this memo on such short notice.
Okay, we're going to move to item 9, update, discussion, and possible action regarding SB 1480, Business and Professions Code Section 4829.5, drug consultation. Jessica, you're on.
All right. For the interest in time, I'm just going to cut right to the chase. There are some concerns with a document that we posted on our website specific to whether or not administer is required. Consultation is required to be offered for administering injectables. Currently, I do not believe that how the law is written that administration is included. There is concern, though, that the dispense and furnish was adequate enough and included the term administer. Because there's a difference in the interpretation, the Senate Business and Professions Committee would like to see clarification through legislation. So with that, I provided 3 questions for the board to consider. Number 1, do veterinarians understand dispense or furnish to include the term administer? Number 2, what outpatient procedures may require administration of a drug where veterinarians are able to provide consultation without compromising the animal's patient's health, safety, and welfare? Number 3, what outpatient procedures may require administration of a drug where veterinarians would be unable to provide consultation without compromising the animal's patient's health, safety, and welfare?
In the interest of time, would you like public to be able to jump in now? Public comment?
Oh, it's this one here.
Okay, it looks like they would like us to discuss, so open for comments.
Isn't what we put down isn't the guidelines, I understand the new now differences or questions about the word administer to dispense. Are you, Jessica, are you asking us right now to change what we posted on the website because there's a new legislative question, or?
No.
Okay, good. Okay.
I am not asking anything.
Yeah, not you. I meant is this agenda item.
There's been a request for the board to discuss the guidelines and the issues raised in the guidelines. So how do veterinarians perceive the new drug consultation requirement? Do veterinarians understand that if they administer a dangerous drug at the veterinary premises, that they have to provide the drug consultation? That's question one. That's the first question. Do you understand that that drug requirement includes administer, or do you not think the new requirement includes administer?
Dueling hands.
So
Okay.
if an animal comes in cardiac arrest and I want to administer some epinephrine, I have to provide the owner drug counseling first.
Do you understand the new law to require that?
No.
Okay.
That's not my understanding of it.
Okay. Can you tell us why?
Because the law, as it was written, was talking about potential side effects of medications that were dispensed to go home.
Okay. Things opposed to an emergency use.
Or as opposed to medications that were administered in hospital, because it would be the veterinarian in charge of that case that's looking for potential side effects. While you're in the hospital, if side effects occur, then the veterinarian in charge should be able to identify those. Whereas if a medication is sent home, the consumer needs to be aware of what to watch out for if there's an adverse event.
Okay, Dr. Bradbury.
So I understood the law to just be related to drugs that were being sent home. So that was my understanding of the law. So dispense to me means drugs that are being prescribed to be sent home with the client. In a typical outpatient procedure, I think that that's different than an emergency procedure. So if I had an animal that came in and I wanted to treat it with an injectable antibiotic,
Right.
and some fluids under the skin, I would talk to the client about that first. I wouldn't necessarily have them sign a drug counseling form because they don't need to know what they might need to know what that is. So I think that is a gray area for an injectable antibiotic that is in an outpatient situation. But I typically would talk to the client about what I'm about to do anyway.
And is that because the current regulation is that you receive the client's consent for treatment?
Correct.
Okay.
Seems reasonable.
Okay, Cheryl.
So the original law said dispense or furnish. So the original law said dispense or furnish. And this is where I think the veterinarians, the public, looks to the board, looks to us to define those things. And that's why I think it's important for us to let everybody know, okay, what are the rules? And where is the line? I think when it comes to regulation, it's always a course of where's the boundary? Where's the line? Which side of the line are we on? And we have to let veterinarians, we have to let everybody know what the rules are so they can comply. When Tara said that, the legal definition of furnish did not include administer, I was like, okay, that's legal. As far as, day-to-day practice, I would hope that certainly if there's any outpatient procedure where the client's not there, that we would not be required to give them consultation. There's not enough time.
Could you tell us if there are outpatient procedures that are performed on the animal patient when the client is not present?
Oh, absolutely.
Because I think there's a misunderstanding about that
So my definition
all
of
outpatient
means they don't stay overnight. They might be there for the day. I mean, my husband just had an outpatient procedure that included anesthesia, and he had lots of papers going home, but none of them were drug counseling. None of them were related to the drugs that he was given while he was, in the outpatient clinic.
So, specifically, like when I've been in conversations about this new law one of my examples is that I'm not a veterinarian, but dental extractions or dental cleaning, just any kind of dental work, is probably an outpatient procedure.
Yes.
Where the client is not with the animal patient while the procedure is being performed. This would be most likely an outpatient procedure, and while you're doing the procedure, you may find that you need to administer directly to the animal patient a drug that you did not previously consult or advise the client that you needed to administer. So I think that's really the hang up here is, are there outpatient procedures that the client is not present for? And do you read the new law to require a drug consultation when you administer or give a drug to the animal patient at the premises?
I only read the law as drugs that we're sending home as the consultation requirement.
Okay. Dr. Nunez.
I think that I understand the reasoning why the authors of this bill would want to include administered drugs in the hospital, but I think the restrictions placed on the veterinarian would pose more harm to the patient if our hands are tied and we're not able to practice what we believe is wise veterinary medicine. It would harm the patient more than it would benefit the patient.
You get a point of clarification. I thought that the word administer was stricken from the bill at some point by the authors.
Okay, so there was a prior bill, and it had very similar language. And during the negotiation of the prior bill, which was, I believe, SB 546 of 2017, the term administer was removed from that bill language. That bill did not proceed. It was held in, I think, a probe, so I'm not really sure. So then AB 2215, no, it's not 2215, it was SB 1441. That was like the omnibus bill, but this had 1448, 1480 of last year. So it included this drug consultation language, which was significantly similar to SB 546. And it did not include the term administer, but it does include the terms dispense,
And furnish.
prescribe, and furnish for outpatient procedures. And so now there's concern that clients may be reading the law to require a drug consultation when a drug is directly given to the animal patient at the veterinary premises, which there is a defined term that means that, which is administer, provided under the pharmacy law, which I believe is included in the drug consultation guideline that is posted. So that's really what we need to talk about is your practitioner understanding of what the new law requires and whether it includes giving a dangerous drug directly to the animal patient at the veterinary premises. Does that mean furnishing to the animal patient or dispensing to the animal patient?
Okay, other comments? Okay. Kathy, I think, has a comment.
I'm a little confused because I do recall the discussions on the prior legislation, and I really thought that, I know what happens in practice with me when I'm at my vet in a situation. They are always letting me know what they're providing to my animal on site or administering if they are. But if administer would then, if you put administer in there, or we actually, yes, use the term administer, doesn't that bring us back to that slippery slope that we discussed in that last discussion of the bill 2 years ago about emergency treatment, and in the middle of the night, an animal needs some medication and you need to consult the owner first or something. I thought that was partially why that was taken out of that bill.
Well, what's important now is that the legislation required only for outpatient settings, so the overnighter would not apply to existing law. But it is, I think, important that you have a conversation about whether or not the term administer could be included in existing law for this drug consultation, because that's something that the legislature is still looking at.
And they also, some of the staffers believe too that including the term administer is not required because it's adequately covered under furnish. So the situation would be if a client takes their animal to the veterinarian for an outpatient setting and the client is there, and at that time the veterinarian gives a dangerous drug to the dog, that then they would have to be required to offer that consultation to the client who's in the room. And that's the understanding from some of the staffers. And so with that, we want to see what the understanding is from the profession, as if that's the case.
Okay, comments, other comments?
I think that right now every one of us does a direct consultation to our clients in the exam room when we're giving an injection there. You tell them why you need to do it, what it is, what drug you're using, and if it's a long-acting drug, I always say that. I think most of us do. We need the client to know why we're not sending pills home, because this injection is going to last 2 weeks or 10 days or whatever the time is, or 4 weeks. So we are doing a consultation in every exam room when we're discussing this with the client. And we're just talking back here, and we believe that if you look at 2032.1, the VCPR, and look at item 3, I guess that is B3, it says the veterinarian has assumed responsibility for making medical judgment regarding the health of the animal and has communicated with the client a course of treatment appropriate for the circumstances. That's what we're doing in the exam room. That's doing our consultation to the veterinarian. It's already in the law. We already have to do it. We already are doing it every single day. So I think the new regulation, the new laws that we have are for dispensing. We already have laws and regulations for consulting in the room when we give an injection or a medication in the room. Any medication in the room. It doesn't have to be an injection. It could be a pill. So under that VCPR, we are presently required to do client information, client consulting.
So I have a question with that statement. If it's already being done in the VCPR, if the Senate B&P staff were to ask, then what is the objection to spelling it out in the statute? What would your response be?
It's already spelled out in the statute in the VCPR. And why are we duplicating it? Because we're not dealing with the same, we're dealing with two different circumstances. One is in the exam room, consultation, medical drug consultation to the client at the time we're administering the medication. That's covered in statute. Now what we're doing with the new law is we're covering a different situation. We're covering consultation with medication going home. So I would propose that we're already doing it. And in the situation that has gotten us here, I believe that the disciplinary process did not go forward because it was believed that the person did not violate this section of the VCPR.
And I would further answer that question is when a pet is in the hospital, the pet is under the supervision of the veterinarian. And these additional requirements may place restrictions on that veterinarian's ability to practice quality medicine.
Well, I don't disagree with the discussion about the VCPR. There are many shelter situations where over the course of a day we may do 50 or 60 spay neuters on owned animals. The owners are not in the exam room with us. They went home or went to work, and they come at 5 o'clock and pick their animal up. There would be great difficulty in consulting with them before we administered a, quote, dangerous drug to their animal because of something identified at the time of surgery or shortly thereafter. The other situation involves in our case, 500 animals that are currently in our 4 shelters today, many of whom, or all of whom I would respectfully submit, have owners. We just can't identify them. Or in the cases where we have identified them, we might not be able to communicate with them. We confiscate animals routinely when people, for example, are involved in auto wrecks and are hospitalized. We have bite cases that are quarantined that have owners, and we physically cannot consult with these owners.
For clarification, you consider a spay and neuter procedure outpatient surgery, correct?
Correct.
That's an outpatient procedure. Okay. Well, thank you.
I just think in one way we're talking apples and oranges because the consultation that Dr. Sullivan referred to under the VCPR is really your informed consent. And all good veterinarians are doing that. The problem with 4829.5 that I'm getting from my clients is that there's a lot that's required here and everybody's struggling with how to provide that consultation. There's simply no way to provide that level of consultation for drugs that you're giving, even if you've got the person in the room with you. And some of it just doesn't even apply. Like if you look at 4829.5, okay, the name and description of the dangerous drug, fine, you could tell them that. You're going to tell them the route of administration when you're standing right there about to inject it into them? I mean, that's silly. I mean, the dosage, I mean, that doesn't apply. Any special directions for proper use and storage, that doesn't apply because you're not sending anything home. Actions to be taken in the event of a missed dose, that doesn't apply because you're not sending the drugs home. I mean, it's just this 4829.5 just doesn't apply to direct administration of a drug. And as Tara pointed out, administer and dispense are well defined in the laws. So it's very clear that administration is the direct application of a drug to an animal. And if the vets had to give this kind of consultation under 4829.5, I don't even see how it would even be possible. And some of it just doesn't apply because it's just silly.
So Ken Pulowski. So if we're going to define a dentistry and a spay and neuter as outpatient procedures, now we have to provide this consultation for all our pre-anesthetic and anesthetic drugs. I mean, could you imagine most of us have some type of form that says, they're going under anesthesia. Anesthesia has inherent risks up to and including death and things like that. So they sign off. I mean, that's some informed consent. But now if I have to go through, okay, ace-promazine, I mean, that can cause low blood pressure, which, we can counteract with this. And then we're going to give them an opioid, which can cause constipation. But, and we go through all these litany. It's like the drug commercials we see on TV. The first 10 seconds is about how wonderful the drug is. And then the last 30 seconds is about all the awful things that it can do. Why would anybody want, if we had to go through this, like that, Jessica? And so if we had to go through every anesthetic and pre-anesthetic drug, of which there's going to be half a dozen, it's going to take a half an hour consultation with that client when they drop off for a dentistry or a spay. And now we're going to do 4 or 5 of those in a day. That's going to burn up half of our day right there. Who's going to pay for that time? The client's going to pay for that time. We've already gone over. I mean, that's administration. That's part of when they get dropped off. And I never anticipated administer or dispense and furnish to be required to something that I administer in the back when I'm getting ready for surgery.
Not to mention the fact that if you use one pain medication and it's not effective, you're trying to find the client to call them to be able to administer a second drug. That's very detrimental. I'm sorry. Anyone else?
In those cases, you may not even know all the drugs you're going to use during the course of the day.
Yes.
Because you have to give something to counteract one of the side effects you did cause, and so now you're doing that, and now they're asking, well, why didn't you foresee that? And nobody would ever get one of those procedures done.
Yeah, I mean, I agree with that in the outpatient, and it is on, yeah. The outpatient anesthesias, we use a variety of drugs for multimodal analgesia and all of that. So it would be very difficult it would be impossible to do that. I was kind of looking at the law as well. We kind of act like a pharmacy. And when we're dispensing drugs to go home, and at pharmacies, they're required to give this like handout to the consumer. And so we're now doing that is kind of how that's how I'm interpreting the law. Like, well, now we're just being required to sort of act in the same standards as a pharmacist who'd be dispensing a drug if you went to go pick up a prescription. And I think if we kind of kept it like that, it would be very useful.
I want to clarify, just providing documentation I don't believe is sufficient to meet the statute. You also have to offer the consultation.
Just like in a pharmacy, they have to
Correct.
offer a consultation. So we do that, yeah.
Yes.
In addition, Grant reminded me that we, all of us in the shelter and some private practitioners hold vaccination clinics where we vaccinate upwards of 200 dogs at a time or at a session. Mm-hmm. And if we had to go through with each individual owner everything about the vaccination process that we are administering, we're certainly not sending it home to them, we could not perform this vital public health function.
Thank you.
And just to be clear, when I hold my outreach events and we do vaccinate upwards of 500 or more animals in 4 hours, we give people a piece of paper that clearly lays out the side effects of vaccines and what could happen and what to look out for. And so we are notifying people via a pamphlet.
Yes.
Do you guys have enough information?
Yes.
To take back?
We'll find out.
Okay. Any more comments from the public?
One last brief comment, Leslie Boudreau for CARFTA. One of the things that this law is already creating an issue with is the documentation aspect of this. I'm struggling along with many other practice managers and our doctors. I've seen probably 20 iterations of how it's being done in practice, from a signature for every single medication administered to just a general documentation in the record that a consult was offered and refused. So there was no clear guidelines of how this needed to look from a medical record standpoint of what sort of documentation. It's across the board confusing already. I think that adds another additional layer to it if we had to get that same kind of, like, what exact information needed to be provided for an injectable medication that did not go home with them, because it's already very confusing because we don't really know what it's supposed to look like. It's not very clear, and everybody is doing the documentation differently in my experience.
Thank you.
I'm sorry to keep going, but when you're going back to the other committee that's asking you to ask these questions, human doctors don't have to go through all of this when they have a child in the hospital and they need to administer drugs to it. It's really only pharmacies that are held to this standard.
Thank you. Any other comments? Okay. Are we done? I think that in the interest of time, we're going to have to turf the rest of our items on the agenda till tomorrow. I appreciate your patience. Thank you very much for staying after hours. Can I get a motion to adjourn for today?
We don't need a motion.
Oh, I guess we don't need a motion. Thank you very much. We always do. Why do we not?